Hi, Dr. Dave Webster, and this video, whatever video letter, whatever you want to call it, is to Mr. Dalton Mcguinty. He is the leader of the Ontario Liberal Party and the Premier of this province, and he has been the Premier of this province during what I believe is the most shameful episode of public health care in Canada's history. That's specifically with reference to how PET scanning has been handled. But the important thing to note is that, as I try to make repeatedly on my website, is that it isn't just about PET. The PET is just a particularly good example of what this government has done to block access to health care. I assure you that what the Liberal government has done over the past few years, starting with Mr. Mcguinty's expertise as a bulldog to look cancer patients in the eye and smile and say no, that started the whole process of the government moving from providing access to health care to blocking access to health care. I can assure you, a physician in this province, I've been here for over 30 years, and starting as a general practitioner, a little country practice in one of the most underserviced areas in this province, and this government has simply moved into the process of blocking access to health care. You need to be concerned. Remember, in 2006, the Canadian Cancer Advocacy Coalition made this extraordinary statement. They said, if you do not want access to modern diagnostic imaging management of your cancers, they meant PET scanning, or treatment, move to Ontario. And as you'll see, it isn't just for cancer patients, and it isn't just about PET. This government has set the bottom rung of standards in the world when it comes to access, to particularly with PET scanning, but applied to many other things. Let me give you an example, Mr. Mcguinty. You, of course, I'm sure, are very proud of this. Ms. Matthews has certainly stated this in answer to how pleased she is with the way the government's been handling PET. But let me just, for you watching the video, and you, Mr. Mcguinty, because you people don't think this requires any comment, do you, the Liberal Party and your Ministry of Health people, but a Cameron, Quebec may do as many as 4,000 patients in 1 year. But the Mcguinty Liberal government and the Ministry of Health and OHIP are now going to, imagine this, allow some PET scanners in Ontario to do as many as 172 patients in an entire year. Congratulations. I mean, clearly, there's no question in my mind and my colleagues that your role has been to block access to health care, and PET in particular. No one on the planet has done it better. Look at those numbers. You've set what I call the Dead Sea limit. Nobody could go lower, I don't think, with why even bother turning the machine on if you got any lower than 172 patients per year. Secondly, of course, what you're doing, and that's part of the bigger picture of how you block access to health care in Ontario, which I will expand on in a moment, but is the OHIP fee to the hospitals and clinics performing a PET scan actually makes it financially impossible to actually do the scan. When you actually see the numbers on the website and the video about that specifically, you'll see that, a child with maybe grade 4 education and can do the math could realize that they've simply made it impossible for the hospitals or clinics to actually supply the service without going into debt. But that, of course, brings along to mind some of the other issues I'd just like to very quickly touch on that I will cover in more detail with subsequent videos and letters on the website. But that is the methods by which you, Mr. Mcguinty, are using to block health care. And this is an election year, Mr. Mcguinty, and I'm going to do my darndest to make sure that health care is a priority issue during this election campaign. And I'm going to do my darndest to make sure that this is your legacy, this shameful travesty episode of health care and the direction you and the Liberal Party have taken health care in Canada. But let's look at, very quickly touch on some of those methods. Bill 8 you brought in, brilliant piece of legislation. On the surface it makes sense. Bill 8, for those who don't know, says it's illegal for a hospital to run a deficit. Sounds like it makes sense, right? Except, of course, like the OHIP payment schedule for the PET scan, what the government does is they insist hospitals, for example, provide certain therapies and diagnostic procedures and so on. They absolutely refuse to pay for it, saying to the hospitals, we want you to provide this service because it would be embarrassing if you didn't for us. But by the way, if you run a deficit doing this, and we kind of know you have to because that's actually how we structure. But if you run a deficit, we're going to, we can publicly, if we choose so, chastise you and pull Bill 8 and say, you've run a deficit, you don't know how to run your finances. I believe this is exactly how they do it. And of course, what is implied by that, and this is the real part on my website, there's not much that is conjecture. Most of what I'm talking about is just a matter of fact. The documents, the letters have been sent back and forth and so on. The motions declaring the trials in Ontario, the Ontario government ran on breast cancer patients and other patients in this province were blatantly unethical, and so on. All that's just simply a matter for public record. But my personal opinion is that how the government gets away with all this is by simply threatening and You have to ask yourself, why is it hospital administrators aren't speaking out in the local media, whatever, saying, you think they really like not being able to supply, healthcare to patients? They think they like having patients that have been admitted to broom closets, literally because there's not a single bed left in the hospital. They're canceling surgeries. They can't supply diagnostic tests. They're constantly being running deficits, and then they have sometimes public announcements, and declaring them that, that the hospital doesn't know how to run its finances. This has actually happened. It was on a news thing Monday, the Minister of Health criticizing a hospital administrator. Wonderful system, Mr. Mcguinty, but why do I believe that personally? And that's because what I've been told by more than one hospital administrator on more than one occasion is, David, you cannot say anything that contradicts or embarrasses the ministry, or they will cut our funding. So you think about it, people, ask yourself, why is it you don't hear people speaking out publicly about what's against the government's doing? There's no question in my mind they work by threats and intimidation. Otherwise, how would they get away with this? I mean, you think people, physicians and healthcare administrators and hospital administrators really do not want to provide you with healthcare? It's clear who doesn't want to provide you with the healthcare, and no one's done it better. There's other things that they've done as well, and there's a video to a letter to Ms. Matthews. Basically, the province has moved into a mode now where, for me, for example, and other physicians to practice medicine in Ontario, it's pointless for us to go to our meetings now. It's pointless for us to read our journals or go to updating courses, because all I need to know, and other colleagues need to know, to practice medicine in Ontario is what OHIP will pay for, and a small handful of government experts tell me I need to know. Even when what they tell me I need to know would be considered malpractice and incompetence in Quebec and elsewhere in the world, and look at my video on how to handle a pulmonary nodule. It is now embedded in OHIP, but it forces doctors to put patients at completely unnecessary high-risk procedures that actually die from on occasion for what turns out to be not even cancer, or benign pathology. See those videos, but that's, again, just simply makes the point of what some of the tools that Mr. Mcguinty and his Liberal government and the Ministry of Health have used to just control costs by simply blocking access to health care. Another one that is another brilliant piece of move that's coming up and is being debated right now is the removal of the technical fee from OHIP that pays hospitals and clinics that do diagnostic imaging services like PET scanning, or whether it's nuclear medicine or radiology and things like that. It's a complicated topic. Look at my video on the technical fee addressed to the Ministry of Health and so on, Ms. Matthews, and for the detail. But the bottom line is that if you can predict the sun is coming up tomorrow, what they know will happen is that healthcare access to diagnostic imaging tests in this province is about to go down the tubes, because once you remove the technical fee, you'll reach a point very quickly where it actually begins to cost the hospital and clinics, private clinics, to actually provide the service. As I said, they funded PET outright, so that it's absolutely impossible financially to really provide the service. But again, don't speak out about it publicly, right? So again, look at that video on that. There's other things that they do. They, for example, they again expect hospitals to provide what we call tertiary level healthcare services. That's high level, neurosurgery, handle multiple trauma victims from car accidents and all sorts of things, very expensive, care and so on. But instead of funding them at a tertiary level funding level, they fund them as community hospitals, a much lower level of funding. But again, don't talk about it. Bed issues, another thing I'll talk about on my website, because again, this is something, if you need access to a hospital, you may have run into already. A good part of the time now, every hospital in this province is running in we call it here in Sudbury, in this hospital, level 3. What that means is there isn't physically a bed left in the hospital, and that's the number of beds the government will fund, but the bottom line is the number of beds that the government will fund is in part based on a commission that was put together and recommendations made, but a formula for how to fund beds. But guess who headed that commission, making recommendations about how many beds we needed for human patients in this province? Dr. Sinclair. Dr. Sinclair is a veterinarian. You heard me. Dr. Sinclair is a veterinarian. Very nice man. Met him, talked to him. Bottom line is a veterinarian ultimately played a major role in deciding how many beds we need in this province, and I'll have some stuff that'll address that elsewhere on the website, and maybe I'll put that on my Twitter when I have something come up about that, so you can look into that in more detail. But the bottom line, Mr. Mcguinty, is that this is an election year, and no one has done it better than your government when it comes to blocking access to health care, using what the Canadian, experts at a Canadian level of national level of expertise in medicine and science have declared blatantly unethical. And Dr. Aldridger, finally in extreme frustration, having worked with the ministry for over a decade trying to move PET forward, got so frustrated he resigned from the PET steering committee, expressed his disgust for ever having even worked with the government. He felt contaminated by his process with the government, and declared that what those who were blocking PET, the process to block PET in Ontario, was bordering on immoral. So, Mr. Mcguinty, election year, it is time you stood up, and I'm going to do my best to make sure this is an election issue. For those watching the video, I would ask you to do the same. There's lots of election issues: employment, jobs, security, all sorts of things like that. But I'll tell you what, get sick and see what your priority is. So I'll have other videos on this very topic, and watch out for them. I'll again announce it on my Twitter and Facebook things that are connected to this. But what I'd ask you to do is don't just challenge your Liberal candidates and Mr. Mcguinty and Ms. Matthews, because I assure you that the other candidates, the other parties, Mr. Hudak and Ms. Horwath, they're well aware of the issues. They won't touch them. They basically support them. So if you think a change of government is going to make any change in healthcare in Ontario, I've got news for you, and it's all there on my website for one and all to see. So please do that. Challenge them. Please get out there make your Facebook sites, whatever it takes to challenge, and do not let up on Mr. Mcguinty, Mr. Hudak, as well, and Ms. Horwath, until they stand up and defend what they've done to block access to patients in this province. Thank you.